Good morning. For the record, Chuck Henry, Director of Sarasota County Health and Human Services. Chair, Commission, appreciate being here to provide this quick update. As always, I like to start with a thank you, and this week I just want to recognize our nurses. Last week was National Nurses Week. Our nurses have been critical throughout this pandemic, whether they're in the hospitals, the long-term care facilities, working for the health department, or just volunteers that came out to really help us work for that. And so I just wanted to take this opportunity to recognize our nurses. Moving on to the data, as usual, I think there's a couple important items on this slide I wanted to point out. Numbers continue to look really positive for us. Cases have slowed down a little bit. Hospitalizations are down. Deaths are down. On the links to long-term care, there was only 3 of those in the last 2 weeks. That's probably the lowest number I've presented to you in the last 2 months. When I look at the percent positivity, I think that's a key item for today. It's at 3.84. I'll remind you that 2 weeks ago we were at 4.94, and 2 weeks before that we were almost at 6%. So it's moving rapidly in a great direction. The case rate is another one I wanted to point out. It's the 14-day average per 100,000 is at 159. 2 weeks ago we were over 300 there. So again, moving quickly in that direction. And then number of cases hospitalized in our 4 acute care hospitals today is down to 32. 2 weeks ago we were 43, so that number is also moving down. And then the ICU is only at 5. 2 weeks ago we were at 15. So we continue to see great progress there in terms of disease in our community. Moving on to vaccines. Again, vaccines continue. We're making progress, although not as fast as I would like to see it happen. Over the last 2-week period, there were probably about 11,000 vaccines delivered, so our number's almost up to 250,000. If you recall, I had hoped as a community we would reach 300,000 by July 4th. That's probably going to be a struggle as slow as things have gotten. We were moving at 20 and 30,000 a week clips, and now we're really thrilled if we get a couple thousand a week. But we'll keep at it through any venues that are out there. Important number here is that people that have completed vaccine series is approaching 200,000. That's a really good number, so we're pleased to see that. And then our percents of those 16 and above is at 64%. That's still second highest in the state overall for our community. I don't have the numbers for 12 and above yet. The statisticians haven't pulled those numbers out for us to do that accurate comparison, but I expect to have that next time I come to see you. And our percent of population vaccinated over 65 remains very high at 88. Talking about variants, as I always do, important numbers there. We're up to 128 in Sarasota County. That's variant cases identified. That's up about 33 from 2 weeks ago. Not a huge surprise or concern. Again, through our normal surveillance, we look for those and identify cases, and it's important for us to do that so that we can determine if the variant strains are causing more rapid illness or causing more hospitalization, or if they ever reach a point that our vaccines aren't effective with them. So that's why we're tracking those. The numbers are pretty straight there. I will tell you for Sarasota County, almost all of our cases have been the UK variant, which is the most common one around and across Florida, as you can see there by the numbers. The other one that we've seen in 14 cases of the California variants, and for the first time I'm reporting 2 cases of the Brazilian variant identified here in Sarasota. So with our vaccine distribution, we continue to do first and second doses at Sarasota Square Mall. And while the total number has slowed down, we're still doing well over 100 first doses every day. And when I add second doses to that, it's 300 or 400 of those every day. And so as long as we still have reasonable numbers coming in there, we'll continue that operation. We continue our efforts to reach minority populations. I gave you that number of 16 and above vaccinated in Sarasota County at 63 or 64% earlier. If I look at our black population, 16 and above, that number is about 40%. So there is a difference, and that's why we're focusing on that. Same for our Hispanic community. The numbers continually trend a little bit lower, so we're doing some special outreach in those areas to make sure that everyone has access to the vaccine. Obviously, through outreach, we're working with any partners that we can connect with. And then I wanted to talk about plans coming up. Last Saturday, we did our first Pfizer vaccine clinic at Sarasota Square Mall for age 12 and above, since that was newly authorized. It's probably our most successful vaccine day in a month. We partnered with the state incident management team, and for just the Pfizer vaccine at the mall, they did 932 doses on that Saturday. 805 of those were for minors. Some parents were getting vaccinated along with their children, so that was really successful. And at the same time, we did another 360 Moderna vaccines in that clinic. So we are planning another clinic this Saturday, May the 22nd, at Sarasota Square Mall, again, specifically targeted to bring vaccines to our 12 and above minor population. The key there is that children, once they're vaccinated, just like adults, will not be excluded from school if they're fully vaccinated. So that's a real key for parents to think about and consider. There's a number of other activities coming up this week. Just to mention, we'll be working with St. Nathaniel's Church down in Northport on Thursday to do a pop-up vaccine clinic
Chuck,
there.
I'm sorry. Finish that sentence, and then Commissioner Dietert has something for you.
I'm good.
Okay. I understand this is going to be your final report to us on COVID. So we're getting to the end of the process. My fear is that due to lack of interest, because we've seen it go from a mad rush to a trickle, if you have a hard deadline, just please publicize that well in advance, because we can't keep these things open forever without having a critical, mass of people using them. So at the end of this long process, people who have procrastinated or were undecided and finally decide after all the clinics are closed, can they just then go to the county health department? Will we have supplies later you would for anything else?
Absolutely, we'll have supplies. And we're trying to position ourselves to also be able to do Pfizer as well as Moderna and Johnson & Johnson. Right now, we do Moderna and Johnson & Johnson at the health department. I don't have the cold storage for Pfizer, but we're working towards that, because we expect over the summer for more approvals to come from the FDA to lower the age group for children all the way down potentially to 5 years and above. And we want to be able to respond and provide those vaccines as soon as that happens. And then, of course, for anyone that procrastinated and didn't get their vaccine and decides they want it, we want to make it easy for them to get it. I don't think we're there yet. I think we've got a lot of work still ahead of us. And I hope this is not my last brief on COVID, although it may not need to be every 2 weeks.
Okay, thank you, Chuck. I have one thought, and then we have Commissioner Ziegler. My grandson, I have 5 grandchildren. One of them is over the age of 12, and it was seamless. He got his vaccine this weekend. So,
Great. Great. Well, we had lines for the first time in a while.
yeah.
I actually called Chuck from the line and said, this is the first time I've been excited to wait in a long line.
Yes,
When I
yes.
was there with mine. So
Well,
Commissioner
my
Ziegler.
caveat is just if, when there's a hard deadline, make sure that's publicized, because the minute you shut down, we're going to hear, well, we couldn't get there due to mobility problems, due to whatever. They've had months and months and months to get vaccinated. Now's the time. We can't keep these clinics open forever.
We continue to work on homebound vaccines. We continue to work on watching the numbers closely. I don't have a hard deadline, but I do plan on maintaining operations at the mall until we are consistently doing 50 or less first vaccines per day. And understand that if we give a first vaccine, we want to be there 30 days down the road, 28 days down the road to give that second vaccine. So we'll make sure everyone's well aware of that to the extent that we can control that.
Commissioner.
What about testing? I know these locations are closing, but what's the plan going forward, that if someone wants to get tested, they work in an assisted living facility or they work in a school or whatever else, what's the plan for ongoing testing going forward?
Sure, I had that on my next slide, but I can talk about it now.
Oh, okay, sorry, I thought you were done.
So testing, as most of you heard, if you're following the news, the state is beginning to phase out their state-supported mass testing facilities around the state. In Sarasota County, that met the facility at the R.L. Taylor Community Center and at the Kennel Club Greyhound Track. Those both formally closed this weekend. We were able to talk to Nomi Health. This is the vendor that's operating the Kennel Club site, and they're very interested in continuing to provide service to our community. They're working through some final details on taking over the lease from the state to stay at that space, and then they'll continue to provide testing at no cost to our citizens, like the drugstores that are also a resource. They'll collect insurance information and bill insurance where it's available, but they'll also provide testing to those that are uninsured. And I'm glad you asked the question, because it's important for our citizens to know the drugstores, CVS, Walgreens, I think they're the primary ones doing testing. There's some other pharmacies out there. You can get appointments with them. Insurance is not required. You'll have to sign an affidavit if you don't have insurance stating such, but they'll still will provide the testing at no cost to the individual.
Okay, so with the vaccine, I mean, you know better than I about the processes and the resources and the demands or lack of interest, but I mean, you know, Sarasota Square Mall, it's been there for a while now, and it's also been there for a while in terms of non-appointment opportunities to go get the vaccine. I guess my question is I mean, why can't we get to a point, and maybe logistically or the demand's not there now, where we have, like in Northport, you just have like a storefront that people can just drive up and, you know, get the vaccine or get tested at the same spot, and then do the same thing maybe in Venice and then downtown Sarasota, and just let that run for a couple weeks? Because, you know, we're at the point where, at least I don't have any stats to show this, but my gut feeling from conversations and being out in the community and talking to people is the first wave where everyone that was just literally begging to get the vaccine for months, and then they kind of came in, they got it all, they signed up for appointments. We saw kind of the rush on the registration system, and then after that, it was people that were still interested, and now we're kind of at the point where the people getting the vaccines, oh, okay, maybe I'll get the vaccine, but if you make it easy for them, they will. So I guess, like, how do we facilitate that? Because I can't say driving down to Sarasota Square Mall, I mean, I live up on Fruitville Road, is the most convenient thing, because you got to drive down there, you got to park, you got to walk in the mall. I mean, if there was a drive-through or there was just a storefront, that'd be a lot easier in downtown Sarasota for me, right? And I think people walking by it, talking about it, I mean, then if you have a conversation with someone that says, yeah, I'm thinking about getting them, oh, you know, it's on Main Street, there's a storefront there. And I'm sure the cities would find a way to work with us on it, but why hasn't that happened? Why aren't there standalone for a couple weeks where people just know it's in their community, instead of these pop-ups that we're doing with churches, which I think are doing pretty successful, but doing something for the overall public in that area?
So one of the big challenges with COVID vaccines, because it was a worldwide pandemic and national emergency, it's only manufactured in multi-dose vials, and no one wants to waste a dose of vaccine. So to have a storefront that's just walk up, and you may or may not get anybody, you may get one, you may get 10, and once you open that vial, it has to be used within so many hours or you have to throw it out. And so we're very careful about planning events where we know we have a certain number of folks coming, so that we try not to waste doses as best we can. And that problem alone makes it more difficult to have the type of just storefront walk up whenever
I just
you
think
want
it's
it.
going to be hard for someone that's, you know, working during working hours, you know, 9-to-5 job in Northport, trying to put food on the table, that may get the vaccine, but they may not have the opportunity to go take a couple hours, or if they do, they're not going to go just to go get a shot to drive up to Sarasota Square Mall. I mean, there's got to be a way we can fix that. I don't know what the answer is, but, you know, for me with the vaccine, look, the vaccine's a choice whether you want it or not, but for those like myself that are ready to open up and keep moving forward, I think that the more people vaccinated, obviously it helps with that effort. But, I mean, I just worry for Inglewood, Northport, you know, I just think it's hard, it's a tough ask to get them to go to the mall. Now, a couple months ago, that's a different story, because they would have driven across the state to go get the vaccine. those group of people. But the group that we have now is kind of, you need to convince them. I mean, it's like sales, you know, you're kind of at the point where you've gone through your great leads and now you're kind of in this middle territory, and you got to convince them to go get it, and you got to make it as easy as possible, to be frank. So I just don't know what we can do to address that. I mean, we have big communities that are a little bit far from the mall, so.
And we continue to try to geographically move around, and I know that's not the same as being in one spot where over time.
Well, and that's the challenge,
people
because
know
again,
that
these
you're there.
people are, they're not convinced to get the vaccine yet. They're still on the fence, right? And then by moving around, they're probably, for the same reason they can't get to the mall, is the same reason they're not going to know about a pop-up site, because they're frankly too busy to sit on our website or sit in the newspaper and reading the newspaper every day. So, I don't know, it's just, it's kind of an interesting problem that you have. But I just know that I think it would help if we were moving that location around, but then letting it sit for a while.
So
We'd get a lot
I will
of-
say that last week, we partnered with, excuse me, the city of Northport at the George Mullins Center to do, and it was primarily Northport staff, very minimal health department staff, and they were open for, I believe, a 5 or 6 hour period, and had 12 people show up for vaccines.
That's crazy. Okay.
It was advertised in the Observer, it was put on web pages, it was in the TV media. So it is a struggle, but there may be some value to one place that over time the community knows that's where it's at.
Why don't we have testing and vaccine distribution in the same spot?
Well,
So it's like a COVID center.
so testing, you're asking people that are sick to come into that spot and get tested. And vaccines, you're asking people that are not vaccinated yet to come in and get vaccinated. And they're probably not a good mix together unless we can separate them far enough on the same site.
Okay, Commissioner Cutzinger.
Yeah, on his point, we mentioned maybe looking at large employers. Is that something we've done, Chuck? We get out there and, as they're coming to work or whatever, make it easier for them to get
We
their shot?
have, and in our pop-up policies, we ask for them to identify 25 people, and then we'll come out, and if it's a little bit less than that, we live with that, but we
Okay.
try to make that our target. Most of the larger employers we've worked with already.
Okay.
PGT comes to mind. They did a closed pod. We just transferred vaccine to them, and they're managing that for their employees. We've been out to the FCCI Insurance Group. There's a whole list of different employers that we've reached out to and tried to work with.
That's great. We got a call at our church about a state-sponsored group that was out here doing the J&J shots. Did you coordinate with them? They were there Monday and Tuesday giving shots out in our community at the church. Is that something you've worked with or are working with?
I try to be aware of it.
Okay.
Those are scheduled directly out of Tallahassee, and they send out a list every week, and I try to go through that list and see are any of them happening in my county, but I'm not necessarily always notified.
I was glad to see
I
it. but I just
welcome
wondered,
their help, absolutely.
if that's happening across the community, that would be, again, getting it out there to the community in different areas. So I just wondered.
We do have a state mobile vaccine bus that's going to be in North Sarasota in the R.L. Taylor site
great.
since the testing center pulled out this Friday. And I know they're talking with the city about maybe being there longer.
There's one more question. With the CDC guidance, when do we begin to open services here in Sarasota County where folks can actually walk into the building
I
department?
think the
question,
county
not a general
administrator will
question.
handle that.
Yeah.
All right.
As I've said, and you've seen my email to staff, the limited number of people who are still on remote work are coming back June 1st.
Okay.
And then in accordance with our department policies, our operating policies, the department director has the ability to do remote work for them. As far as the facility itself, we will start those same kind of things because by the end of May, everybody who has wanted to receive a vaccine has had that opportunity. We are still sensitive, though, that we do have employees that have medical issues that would prevent them from getting the vaccine. And so we are still conscious of that and what that might mean in our facilities. So you'll start to see that June 1st.
Thank you.
All right, Chuck, I think you have a few more slides.
Sure. I had one more on this slide. I just wanted to mention, it's not on the slide, but we're doing a joint pop-up clinic with Manatee County at Creart Latino Cultural Center this Sunday afternoon. It's on 15th Street right behind the airport there, so it's in a Sarasota zip code, and they draw from both counties. So we're hoping to see a pretty good crowd there.
Okay.
Key messages for the community that I like to cover, vaccine is really the key to ending this pandemic. We keep talking that's really the solution, and we encourage people to get vaccinated so they can not only keep themselves safe and their families safe, but help our community move forward in a more rapid pace. Testing resources I talked about. This is where I was going to talk about our agreement with Nomi Health to continue operating that site. We're also exploring the opportunity to maybe get a site in South County somewhere that's going to stand up and be there to provide additional testing. We do still operate, health department still operates in conjunction with the school board, sites in Northport, Nokomis, and then at the main health department site, where we offer testing to students and family members of students and have for the entire school year since we started testing. We do want to remind everyone, if you're not fully vaccinated, you should continue to social distance and wear masks when you can't social distance, especially if you're in a public space where you don't know the vaccine status of those that you're around. And again, the definition of fully vaccinated is 14 days beyond completion of the vaccine series. So that's a really important item. I left this next bullet in here because last time I was here, I noted that Sarasota County, by CDC's guidelines, was still at a high level of community transmission. We're now down as substantial, so we've come down. There's 4 levels: low, moderate, substantial, and high. We're actually on the low end of substantial and about to move into that moderate very soon. So things are trending in a good direction for us. And those last 2 bullets, of course, those are lessons we've learned in this pandemic and habits that we've all picked up to wash our hands more often and more vigorously, and to stay home when we're sick. And those are habits I hope everyone continues long after this pandemic goes away. That's all I have for you today, unless there's other questions.
Thank you very much, Chuck. I think we've asked the questions. Thank you, as always.